Welcome back to those who have caught episodes in the past. And for those of you who are new, welcome to Dreams, Dollars, and Destiny. I'm your co host, Portia, joined by my friends, Nick and Malinda, and we're here to bring you another action packed episode. You know how we do. Now, one of the things that I also want to touch upon is that we're very grateful to you guys who have been tuning in week after week, and making this show a success. So, hats off, salute to you. If you've been showing up consistently, we really do appreciate that. And like I said, we welcome you back. Now, tonight's episode, y'all, look, we touch on everything. It doesn't matter. We touch on all aspects of life. And tonight we're talking about healthcare, y'all, right? This healthcare system that we're in America, some ain't right, some ain't even, right? It seemed like African Americans have always faced some type of deeply troubling disparity when it comes to healthcare access, and then also what happens in the healthcare system with us, right? And so it's just a perceived thing whenever we go to the doctor that we probably are not going to get the best care, right? From high rates of chronic illness to maternal mortality rates being high, because there's a lot of women that die in the hospital just giving birth. And so this is an implicit bias in diagnosis and treatment as well. And look, y'all, the gaps are real, right? The math is mathing. We're seeing the numbers, we're seeing the percentages, and they're vastly different between medical malpractice with African Americans versus our Caucasian counterparts. But you know what? How did we get here? Right? America has a long history with us being, the kind of like the redhead stepchildren, right? We're always treated last. And to be honest with you, we don't ever get the best treatment on top of that. So in this video, we're really going to take an honest look about the healthcare disparities here in America, why they exist, and what it's going to take to finally close that gap. So let's get into it tonight. I have quite a few things to kind of open up the floor with. We were talking earlier, before the show about some things that were going on. It's just the playing field, we're going to have to level it. We're going to have to level it on our own terms when it comes to medical malpractice and what happens as far as healthcare access. I know alone in, in one of the major cities that I live in, a lot of the hospitals on the black side of town, right, closed. And so a lot of African Americans are having to travel across town just to get healthcare. And what if there's an emergency situation, right? Sometimes it can take, hours or so shows up before the ambulance shows up. So, it is one of those things that we're living in as a reality, but it doesn't have to be that. Now, I did pull up some information about some of those numbers. Give me a second here to pull that up, because I wanted to talk about the numbers here when it comes to disparity on cases when it comes to Black healthcare. And, we have a good fear of going to the doctor, and the fear is real because oftentimes we're just seen as sometimes medical experiments, sometimes not seen as people at all, right? So, one of the categories that I want to talk about is exposure to negligence. We have higher risk of hospitalization, and then our Caucasian counterparts, higher likelihood of receiving top tier care versus us, right? They kind of overlook the symptoms and what we're telling them we're going through, and they just dismiss what we're saying. They don't ever really look into that. Symptom validation, right? That's what I'm talking about. They don't really validate us when we tell them we're going through certain things. They just kind of wave it off. Whereas our white counterparts get proactive and defensive diagnostic treatment. On top of that, system reporting. So research indicates hospital staff are statistically less likely to log potential malpractice events for Black patients. But there's an internal safety and malpractice database shows a high rate of proactive services given to our white counterparts. So listen to what I'm saying. Even when something horrible happens to you at the hospital, it goes unreported because you're Black, right? And legal accessibility. Faced with lower economic damage projection, of course, due to systemic wage disparities and things like that, it makes it harder for us to secure representation if something were to happen at the hospital. So that means that a lot of times we can't afford an attorney, right? Not unless you got a really high profile case that has a lot of money involved. Attorneys are not knocking down your door to take your case. But then on the Caucasian side, right, they have more favorable economic, damage calculations based on average higher historical wages. So that means that based on the numbers, their lives are worth saving, right? And so they get the best treatment. They also get the best and top tier legal defense if they do have a malpractice suit. So, it's just a lot of unevenness when it comes to looking at medical records, the malpractice, the lawsuits, and then the access to health care, with African Americans. So I just want to open the floor up with that information. I'm sure that you guys want to take it over from there.
Okay. I'll jump in. I normally let Malinda go first, but since she's having some technical difficulties, I'll go first this time, just in case she has some tweaks she needs to do before she unmutes. But peace, and love to the Dreams, Dollars, and Destiny family. Welcome back to another episode, another very important episode. Of course, every episode and every topic is important, but I perceive this health topic to be one of the most important because it's the foundation to everything else. Because previous episodes, we talked about learning AI systems, we talked about learning our real and proper history and changing the narrative. We talked about corporations and not buying into their ploy. We talked about finances and wealth management, starting businesses and selling products and services. What else we talked about? We talked about supporting one another, supporting each other's businesses, and then just in general, pursuing our dreams, dollars, and destiny, as the name of the podcast tells us. But we can't do any of those things if we're sick, if we're in pain. So your health is, I know it's cliche, but your health is wealth. But it's very true because you can have all of these other things, but you can't enjoy them or you can't even pursue them if you're in a state of dis-ease. So that's why this topic is important, and I'm sure when Malinda speaks, she will talk about the areas of human activity as health being one of those. But yeah, I just want to lay that out to let the family know why this is important, why health is so significant, and we're going to make you aware of some of these facts that Portia already introduced and the reality of what our people are facing when it comes to health, and to give you some practical steps on things that you can do or at least take the first steps towards mitigating the health crisis that we're facing.
Peace and love, peace and love. I hope I can be heard. I'm going to be not doing a lot of moving around. But yeah, I want to say peace to everybody out there. And this is a very important topic, just like all the other topics that we have talked about, just like Nick said. This one really hits home because this is one of the topics. Because when we talk about health, our health is our wealth. So if you're healthy, doesn't matter what else is going on, you can see another day to go make that money, to go, retry that dream, retry that goal. But when you're not healthy, there's no amount of money in the world that can fix your health, right? Sometimes. So the important part about health is you want to try to stay healthy. And as we've been going over a lot of these other topics, we see the systemic problems and issues throughout all the areas of activity. And like Nick said, health is one of them. And health is one of the ones that I actually added on to the 9 areas because, I felt like it did need a little update because we do face such disparity in healthcare. And when I say about healthcare, I mean like pharmacy, pharmaceuticals, the drugs, the patient care model for Black Americans, because like we know that we live in a country that's based on two systems. We have two justice systems. We have, to everything's in double. One's for one group of people and one's for another group of people. And then the others, you're either going to fall in somewhere on that spectrum, right? So when we talk about healthcare, it's no different. And it's so bad with healthcare that in 2008, the American Medical Association did a formal apology to really all Black physicians because of the bias and because of systematically shutting them out of things and all that kind of stuff. So this is really a very important subject that we do need to really pay attention to. And we also need to pay attention to ways that we can advocate for ourselves, because oftentimes when we're in healthcare settings and when we do try to advocate for ourselves, we get labeled a certain way, right? And then they put certain keywords into our chart, like difficult patient, difficult, doesn't want to take the medication and things like that. And when those labels get put on your health chart, you know, that's a signal that they're sending to other healthcare providers when they receive your chart. Because as we know, everything's electronic now. So wherever you are in one health record, that's where your health record is going to follow you. So a lot of this stuff is done that way, and it's so bad with the healthcare system in America that even the machinery that we use, the lab testing, the values are all based on a biased system. So that's something to think about. And there was even a doctor, I forget his name, but he does content. And he actually pointed out the bias in the spirometer, which is a thing that you do, a breathing test that you do. And there was a bias in it, like that was against Black people. And he pointed that out, and he actually took that to court and won a case for them to actually reverse that and get that, that language reversed in that spirometry, testing exam when they give that exam. So they have to even change, lab parameters based on the biases in healthcare. And that's kind of how deep it goes. And then what I'll just say before I land is Black Americans have been dealing with disparities in healthcare since America has gotten colonized. So we can say since 1492, we can say since 1619, you can say whatever date you want to say, ever since they've come here, they've been treating us with disparity in healthcare, mistreating us, our bodies, experimenting on us, very cruel and intentional things that they do to us to the present day. And I'll land there.
And that actually is a good segue into what I was going to talk about next, which was the Tuskegee experiment. Because, it's been a long history between us and the medical establishment, and they have given us plenty of reasons not to trust them, right? I mean, it's been a long history, starting with the Tuskegee experiment. I'm not sure if a lot of people know about this, but this was an experiment that was done between, and this is the crazy thing, y'all. This thing didn't go on for a year, 5 years, not even a decade. It went on for 4 decades between 1932 to 1972, where they thereby infected 600 African American men, right? Mostly impoverished, uneducated, right? Those are the ones they always target, and gave them, of those numbers, 399 they gave syphilis to, right? And then the other 200 were a healthy control group. So they kept only 201 healthy, but majority of them received the syphilis. And then they were told that they were getting treated for bad blood, right? Which is a local colloquialism at the time to describe various ailments like anemia and fatigue. And then they started withdrawing the treatment because these men didn't know what they had. All they knew was they started to come up with all these different symptoms. And they withheld the treatment, even when penicillin became universally accepted, right, which is a highly effective cure for syphilis in 1947. They refused treatment to these men, watching them suffer and die. But you know what the sad part is? And I just have to tell y'all what the sad part is. And I'm not saying those men losing their lives were not sad, not by any means, right? Not by any means. I know a lot of grief went into those families because they lost the breadwinner, right? A lot of those men were the breadwinner for their family. And so families weren't able to survive after that, but they did file a class action lawsuit in 1973. But you know how much they paid these people? So the syphilis group, the ones that were infected, if you were still alive when this payout came, you only got $37,500, right? If you died, right, your heirs got $15,000. Now, if you were part of the control group that didn't get affected, then you got $16,000 if you were still alive. But if you passed away, then your heirs only got $5,000 or $15,000. That's all their lives were worth at this time. So, that's just one thing. Also, back in 1834, there was a fire that broke out in New Orleans plantation. And when they broke into the house to save the people that were in there, come to find out that they had mutilated slaves who had body parts sewn on backwards. They were chained to the walls and floors. They had spike collars on their neck. They had been physically tortured, and they had been running medical experiments on these people as well. So just thinking about the history that we have gone through, also talk about Henrietta Lacks, right? She went in for a cervical cancer. They took some of her cells, but they had been trying to mutate and regenerate cells prior to this. Never been able to. Black woman comes in, she got the super cells. And till this day, right, her cells are still being used. The only reason why her family even found out about that is because them greedy medical doctors came back to them looking for blood samples because they were trying to see if they had the genes too that Henrietta had. That's the only reason why they knew that these people had been using her cells. So, the medical system has given us plenty of reason for us not to trust them. And I always say, do your research. Don't just follow your doctor blindly. And you're right. Sister Malinda pointed out the fact that the moment you refuse what they're trying to push down your throat, you are labeled as a problem patient. As a matter of fact, there was a guy who, I think he had some type of cancer he was diagnosed with, but he refused to go through that treatment, the whole radiation treatment and all that. The doctor's like, you're being difficult. This is what I'm telling you need to do. Because remember, they try to come from a place of authority. Like, you have to listen to them. I have a medical degree. I'm the one that went to school, right? I'm telling y'all, that's not the way to go. Listen to your body, right? That's the first thing you need to do. And always go get a second opinion. I just always feel wholeheartedly that the medical establishment, it was started by Rockefeller. Let's start there. It never had intention to save lives. It was always for profit, right? That's the reason why it was created. This is what modern medicine is about. It's a for-profit organization that just so happened to be in the healthcare field. So I'm gonna let some of my cohorts, talk on that. But I just wanted to bring up the history and where we are now today with modern medicine.
Yeah, and I'll just say something about the modern medicine piece. There's a saying when it comes to comparing the condition of mainstream America to Black people. They say something like, when America has a cold, Black people got the pneumonia, something like that, or the flu, or whatever, or however the saying goes. The same thing applies to healthcare. So we're focusing on our people specifically, but the healthcare system in general, designed by the Rockefellers, like Portia said, it doesn't benefit anyone. We just happen to get the worst of it because there is a hierarchy to it, a hierarchy that intersects both race and class. So I just wanted to point that out, that this show's focusing on us, but every race is being misinformed about health. And then when you compare Western medicine to maybe Eastern medicine or other cultures, not only does this modern healthcare system tend to focus on treatment rather than cure, they also disconnect the physical health from the emotional, spiritual, and mental health, while other cultures connect them together. That's why they call it holistic health, meaning that the mind is connected to the body's connected to the spirit. A physical ailment might be the manifestation of something emotional or spiritual that's happening internally. So from multiple angles and multiple perspectives, where the healthcare system is being misused and misrepresented. So just wanted the folks out there to keep that in mind as you think about all of the malpractice that's going on, all of the discrimination and the racism going on. It comes in multiple shapes and forms.
Yeah, they said that we couldn't feel pain, and so they would do surgery without anesthesia and things like that, right? We're not supposed to feel pain. So I think that still carries through with the modern medicine.
Yeah, that does still carry through with the modern medicine. And like you were saying earlier, it's not just about the healthcare, it's about the trust, the access to healthcare, you know, the trust in the treatment and our survival at the end of the day. And, you named a few of the disparities that have caused Black Americans to not trust the healthcare system. I know a lot of us didn't want to get that jab, and it's just because we know that we're usually the first ones that they try to do some type of experiment on when they're doing it. And actually, I believe Bill Gates said, let's give it to the people in Africa first. So this is what they do, and it dates all the way back to really, like I said, the 17th century. And we can't leave out J. Marion Sims because he is called the father of modern gynecology, but his legacy was built on torturing and experimenting on enslaved Black women. So, he did all of these experiments, all these hysterectomies, like you said, no anesthesia, no type of painkillers or anything. And this is how they discovered their modern gynecology. And then you fast forward that to today, where the maternal mortality rate for Black women is at 40 per 100,000 people. So that's a lot. We have a high mortality rate for maternity. And that just goes to show you that to this day, that gynecology system that their racist founder founded his parameters on is still in effect to today. And our infant mortality rate is also higher today than any other race or ethnicity. So, this just goes to show that the bias has been there since the beginning and that the bias continues to be a bias. And I had put this up. This was the AMA. They had to publicly apologize for excluding Black physicians from medical societies. So they excluded them, and there's only 5.3% of Black or African American physicians that make this up anyway. So there's only 5% to boot, and you're excluding those 5%. And the premise behind the apology, and what some of the Black doctors were saying were, if you're mistreating us as the physician, then God knows what you're doing to the patients, right? So, the Black doctors that are there, they go through the same racism, with their colleagues and with their peers, no different than any of us at any of these corporations or companies that we have to work at every day. And then in 2019, there was a study found that there was a bias in health risk algorithm, underestimating the needs of Black patients because its healthcare used like a spending proxy as their algorithm. So that made it be like, even when we needed more health, we didn't get it, and we couldn't get it because it stated that we didn't need it. This is the type of stuff. And it also says that if they would have corrected the bias, it would have increased Black patients receiving extra help from 17% of the help to 46%. So that's a huge difference in how many more people would have received treatment and the proper health care if they didn't just have biases in just their algorithms. So it's very deep and systematic.
It is. And also the lack of access to healthcare, right? There's not too many hospitals or clinics in the hood per se, right? A lot of that you have to drive across town. And sometimes if you need immediate care, that ambulance ride can be very long, thereby somebody may lose their life because you don't have access to a healthcare facility that's nearby. And then also food deserts. We want to talk about that. What I mean by a food desert, there's lack of healthy, organic, fresh food, vibrant food available in the community, in the neighborhoods where people could have a healthy diet, thereby kind of bypassing the whole medical thing, right? Because everything is linked to the diet. And Nick did point out that the doctors here don't treat us in a holistic manner. because if they did, they would start with what have you been eating, right? And start looking at your diet to see what may be affecting you. So we already know that they never ask for that information. They never try to see if what you're eating could be causing, or maybe you're a lack or deficiency of something. Maybe you're lacking vitamin D. Maybe you're lacking this and that. They never look to the simple things for that. And I know as a Black woman, when I had fibroids, the first thing I went to, I count 5 different doctors. And the first thing they said, oh, you're 40, we can just remove your uterus. Right? That was just the immediate thing. And I hear that from Black woman after Black woman after Black woman. We are, I don't want to say cursed with this fibroid issue, but at the same time, it seems to affect us as a group more so than others. And since it's African American women that are being affected by that, guess who gets no funding research, right? Who doesn't get money for that research? And so we're often having to figure out stuff on our own. Now, there have been a few doctors who have started to look into fibroid research and things like that, but it's nowhere on the scale where it needs to be. So we're having to find natural remedies to help us with that. But yes, the first thing they say is that they want to take your uterus. Why? I'm always leery because of that. And that one of the things is they don't want us procreating, right? And so if they take our uterus, then you can't procreate anymore. And a lot of women, Black women, unfortunately, we fall for it every time, right? Thinking that's the way to go. But I always encourage you, go and look for alternatives, because remember, doctors make money through surgery. They're not going to tell you, oh, there's this 15 bottle of herb that you can go buy, right? They're not going to tell you that. No, they're going to tell you need that surgery so they can make 40, 50 G's off you, right? And charge your insurance company for that medical billing. So we have to start taking our health into our own hands, especially something like that. We can start women's group, focus groups talking about fibroids. I think it's really a topic that needs to be brought up more often than not, because a lot of women are being affected by this. And men, yes, that includes your mother, your sister, your auntie, right? I know you guys know women who are also affected by this and that need to be, talking to other women that could help each other.
Yeah, not to mention the price of health insurance. Like, unless you're getting it through your employer, whew, trying to pay for health insurance, like just on your own without a company benefits, it's outrageous.
It's murder, right? And Obama tried to help us, but they didn't want that Obamacare, right?
It certainly is outrageous. And yeah, they did fight against that Obamacare. And there's actually a statistic out about the health insurance. And it is the uninsured rate for people under 65 in 2024 for Black people was 10.1% versus the 6% for white people. So there's a
Yeah,
huge disparity there.
that's sad. And you know what? There was a story where this 11-year-old Black kid died because of abscess, right? Something as simple as having a tooth removed. His parents didn't have the money to do it, and he wound up dying because it ruptured. Something that simple. And they always try to spin that money is the end goal. But let me tell you this: when Steve Jobs was on his deathbed, don't you think he would have given up everything he had to get his life back?
Yeah,
Let's be 100. You know what I'm saying? So it's not money; it's time and health. Time and health. Those would be the two things you should always be chasing in life. Because one thing, time you'll never get back, and if you don't have your health, you don't have anything else.
exactly. And
So that
another thing is, we do have to make sure that we are advocating for ourselves and then also for our family members who are like maybe older. We got to try to take time out to go with them to the doctor because a lot of our older family members will go and just listen to everything the doctor says and be doing everything blindly what they say. They do this stuff to us, and because they don't think that we have advocates, and they also don't think that even if there is family, they don't think we're smart enough to advocate for the right thing. Because I'll tell you, just from my personal experience of dealing with a lot of health issues and stuff and with people in my family, when they know that you are an advocate and you know what you're talking about and you're in there talking to them on their level, they straighten up real quick. They get themselves straight real quick because they know, oh, wait a minute, I can't play with hers. That's so more of us have to advocate for ourselves and we have to speak up. And even if they want to label us a difficult patient, you know what you have the right to do? You have the right to take your health care away from that physician, away from that entity in that hospital, and go find you another one. And I know that could be easier said than done, but would you rather stay with a doctor who is going to be difficult with you and not listen to you when you're telling them certain things about your health and your pain? Or do you want to, let me go find somebody else that I can at least, get on with? And it's important. It's important. And we have to advocate for ourselves because there's a lot of that we don't have.
Yeah, you're right about that because it reminds me of a personal story about my grandmother when this was about, I think in 2010. She used to go to this doctor and he write out a prescription for everything, right? And then she started getting sick, and come to find out she had to be hospitalized and all this stuff. But what the issue was, she was taking too many medications and they were having reactions with one another. That's pretty much what the bottom line was. But she was just taking it because the doctor prescribed it, never looking the drug up, never looking at the side effects, never seeing how each one would interact with one another, because these doctors are making money from these prescriptions, right? They whip out that pen and pad real quick so they can cash a check. So they're not thinking about what the end result's going to be for you. And just like we keep pushing this in the forefront during this episode, you need to put your health in your own hands. The doctors don't care. They care about the dollar that you bring to them. And that's why they prey on the elderly, because now I remember when my great grandmother was alive, she lived till she was 94. But during her 90s and her 80s, she wasn't going to the doctor every month, every 2 months, or nothing like that. She was not on a regular schedule. She was a healthy woman and all this good stuff. But now it has changed where these doctors see payday off these elderly people. And so they're getting them in like every so often so they can get paid off of them. Right. So you have to watch out for that trap because that generation, they're so trusting, right? They're so trusting in what the authority says, right? Our generation, we're not like that. We're going to question everything. But their generation, if you're a person of authority, they're not going to question it. You went to school. You're the one that got the degree. I'm going to have to listen to you, right? You seem to have the most experience and know what you're talking about. And you know what else they do? And they were trained to do this is use those big words, encephalitis and itis this and itis that. They use the Latin medical terms to make it seem like it's bigger than what it is, right? To confuse you, to overwhelm you, to make it seem like, oh, well, the doctor must know because he says I got this type of itis. But when you break down the root of the word, itis just means inflammation, right? And so you start breaking down the etymology of a lot of these Latin words that these doctors throw around like they're gold. It's just broken down into simple terms. So we need to really start educating ourselves, right? So when we go talk to these doctors, we are on their level because trust me, the only reason why they know these words is because they study them, right? At the end of the day. And they're nothing big, they just sound big because they're multisyllable.
Yeah, and there was a study done. Like there's studies on all of this stuff. So when we're talking about this stuff, this is all stuff that's verifiable that you can go look up. And this stuff is true. It's out here. When you go look at it, it's out here, and you see all the biases that they use, whether it's through their parameters and testing, the metrics that they're using, believing that, Black people have like a lower lung capacity and all that kind of stuff. That was a part of that spirometry lawsuit that they had. And, there was a research article published about the pain treatment bias, and it found that there were false beliefs about the biological differences between Black and white people that actually affected the pain assessments and the treatments negatively. And it really explains why we're undertreated, we're undercared for. And there's studies, they have studies to prove this stuff. But the problem is, what is anybody doing to change it? What laws are being put in place to change it? And that's where the angle where I want to come in and say, hey, as a nation, these are the kind of things that we need to be nation building as far as those 70 cultural central principles that I mentioned last week. That's the kind of stuff that you can build. You can build out your own stuff like that and try to get it passed and get different bills passed, because we've been going through this stuff with the healthcare industry, like I said, since colonization. Like it's been going on since then. The same mindset that they had then is the same one that they bring into their healthcare industry now. And of course everyone will try to act nice and all that, but let me just tell y'all, like, y'all see these racist comments and stuff like when you're on Instagram and all. Who do you think these people are that are making these comments? These are the people who work in these hospitals. You know what I mean? They work in your community. They work in the bank. They work at the dealership. They're the judge. They're the lawyer. They're the this. They're the that. They're the nurse. They're the doctor. So you think that you know you put one and two together, this is why we're treated this way, because this country is still inherently racist. And you can see it through every system, through every area of activity. It's very prevalent, and that's the way that they carry out their plan. So health is very important because, again, that's a part of the way that they use genocide. And one thing that we didn't mention, which I'll mention real quick, is Margaret Sanger back in the 30s, right? She had that Negro project where she was trying to do eugenics and get rid of all the black communities. And that's why you see a Planned Parenthood. You won't never see a Planned Parenthood in a white community. You see Planned Parenthoods in inner cities, and they actually show you how they planned out to where they were going to put these centers at. Okay. And they put them there for a reason, because they want us to abort our babies. They want those stem cells because they're using those stem cells just like they did Henrietta Lacks, which they're still using her stem cells to this day for a lot of the treatments that they have. They still using her, and they ain't even properly dealt with her family. You know what I'm saying? So I could tell you throughout every century since colonization, I can give you at least one. Usually there's more than one, but I could give you at least one health disparity and health treatment disparity with the Black American nation that has been done to us throughout every century, almost every decade in every century. They do something different, and it's to cause genocide in our community. Because don't forget, we've said it before. What's their goal? They want to kill that black messiah. You know what I
Yeah.
mean? They want to get rid of that. That's why they kill us in the streets, and the police are authorized to kill us if they think we stole anything. Could have been like the boy they say that stole the water. Bam, you're dead. You stole water. So if you're looked at and viewed that way systematically, everyone feels like they have a right to treat you that way. And that's
Yeah.
what happens.
And not to mention the way our neighborhoods are set up, right? They usually set these neighborhoods up by plants that have a lot of smog and pollution. On top of that, they have a lot of unhealthy food, fried chicken on every corner, liquor stores, right? And so they're setting you up in an environment for you to be unhealthy, right? For you to
Mhm.
be sick and for you to depend on this crack medical system that we have. So they're basically creating patients, right, in the environment that you're living in. And you have to see beyond that in order to thrive, right? Because again, I just mentioned that there's lack of fresh fruits and vegetables in black neighborhoods, and that is totally by design. But you can spend a couple of dollars and get whatever unhealthy fried food, fast food place that you want to eat, anything that's going to clog an artery. Yeah, you can have access to that.
And they'll make it real cheap for you, dollar menu.
Mhm. Yup, and not to mention, it's um, it's never. I won't say it's never, but it's usually not our people who own these establishments either. And I know
Hmm.
we talk a lot about white and black, but there's a lot of other groups out there besides the Caucasians that set up shop with these unhealthy options, in the hood. So
So that's by design too. It's all by design because we know that, and we gonna call it straight out what it is. They are the buffer class. That the immigrant group, all immigrant groups are buffer classes to buffer between us, the blacks on the bottom, and the whites on the top. The immigrant group is in the middle to buffer and to kind of keep us. And that's what they're told when they come here. You come here, you set up a shop, you make money off these niggas. You're gonna make money off the niggas, and you can treat them like niggas. This is what they do, and we can see this playing out in everyday society. And I'm not saying that's what all of them feel with everybody, but the majority of these relationships that we have with these poppy stores, these corner stores, these gas stations, is not a good one. And we can see that through the interaction. They don't respect us. All they want is our dollar. And they have been brought here as the buffer class to be given those businesses, okay? Because that's not only benefiting them, that's also benefiting the dominant society, because they're having to pay taxes into that, and that keeps business and industry going. And then these people get to make their money off of our community. And what happens? We don't end up getting to own anything. Why do you think we have $1.3 trillion in spending power? Because we don't own anything. All we have is spending power. We can't own houses, we can't own businesses at a high rate, and at a frequent rate. So we're left with all this spending money that all we have to do is spend on frivolous shit that we don't need, because we're not allowed to buy assets that can actually propel us out of the hood. So this is by design. I just can't say that enough. That's the design that they made, and that's the one that we're running through this maze on. And until, like I said, and always keep saying, until we get ready and stand up, it's going to continue.
You're right about that, and the lack of access to these things, like you said, because I can remember, seeing some kids in the hood. They get a couple of dollars, they ain't had nothing to eat. The first thing they do is go to the store and get a bag of chips, some sweet to
Mhm.
drink, and that's food for them, right? But that's
Right.
not healthy, and they're not being taught, to eat healthy and have the proper meals and stuff like that. And to be honest, they don't have access to that at home. So
Right.
we really need to push an initiative to where we're feeding the children healthy meals. They know what a healthy meal look like. It's not a bag of chips and a soda, right? And so I think it's more or less the education piece that needs to happen as well.
Mhm.
Yeah, and yeah, because I wanted to talk about the education piece too. But yeah, and it's important to start the children early with healthy foods, because all of the bad foods, the ingredients that they're made out of, they're made out of these addictive ingredients, to where you want more and more and more and more of it, and anything that's healthy seems nasty to them. I work in the inner city, and there's corner stores on the way to school, and first thing in the morning, 8 o'clock in the morning, they're eating, Takis, chips, bacon, egg, and cheese sandwiches, fried chicken, Italian cheeseburgers, all of that. First thing in the morning. So it's real. It's very real, and the education piece, that's very important, especially for our conscious people out there. You want to educate yourselves and educate your people on health just as much as you educate them on history, just as much as you educate them on finances. The health should be on on the same level as those areas, if not higher. But one thing I will say though is that I am happy to see more and more people waking up, more and more people getting into herbalism, becoming certified herbalists. Um, Maybe I can't speak for around the country, but you can find a handful of health food stores and herbal shops in the community too, and they're usually they're usually mom and pop businesses. So going back to supporting one another, those those health food stores, and even if they don't have a brick and mortar, if they're an herbalist and they have a business where they're selling their products and they're shipping their products out, those are the ones that we need to use our spending power. If we're going to use our spending power, let's use our spending power for our health, and support those brothers and sisters that are providing those options to the mainstream modern healthcare system. Now, of course, disclaimer, we are not giving anyone medical advice here. We are not doing that. We're just give you suggestions for things that you should look into and do your due diligence. Especially if you want to support someone that you may not be familiar with, because every person that calls himself an herbalist isn't educated or hasn't done their due diligence. So you want to make sure that you vet everything and everyone before you start to consume, certain products or certain supplements, or following the advice of alternative medicine. So you want to look into both the doctors in the traditional field, and you want to look into your alternative medical practitioners too. You want to make sure you vet everything, regardless of who they are and what they offer.
Yeah, it goes back to not just trusting blindly when it comes to your health, right? It always goes back to that. You definitely want to take what the doctor says with a grain of salt until you actually go do your own research, your own due diligence, even getting second, third opinions before you just go with what they just said. And we did the numbers on the amount of black physicians. I'm not saying black physicians are better than whites and whites are better than blacks, right? I don't want to break out the whole race thing saying, oh, yeah, you should go to a black physician. What I'm saying is you should find a doctor that resonates with you. And maybe that's not a medical doctor. Maybe that's a doctor of natural healing, naturopathy, I think is the name for that, right? That's an ND and not an MD, right? Find a doctor who does natural healing and that works with herbs to heal patients, because there are some holistic doctors out there. And I found even a few that have left the medical field to go into natural because they realized that medical was pushing poison, right? Always trying to push those pills down people and with those horrible side effects in the end. And so these doctors actually had a heart and a conscience and switched over to the natural side and now treat people with the herbs and natural remedies that can help cure people for way less than what the medical establishment is what charging for. Because to be honest with you, a lot of things can be simply cured by diet, maybe increasing your water intake, taking certain herbs and supplements. That can cure a lot of things. But at the same time, you have to be disciplined because sometimes it may require a special diet. I know sometimes it may require you to fast. But if you're not willing to put in that, like I know, for instance, a woman was diagnosed with diabetes, but she didn't stop eating sweets. And guess what happened? She lost her leg, right? So we need to really start taking our own health in our own hands. And when we're diagnosed with certain things like diabetes, then you need to stay away from sweets and stuff like that, right? Mind your diet because your diet can be the key to unlock your health. So I always like to go with diet first because a lot of things can be healed through food. Let thy food be thy medicine. And that's the way it was. I mean, before Rockefeller put this medical establishment, he actually wiped out all the natural herbalists that were around. He bought up all the pharmacies and then closed them down, the ones that were doing the natural remedies, giving people the herbs and natural remedies that they needed to cure themselves. So before they even put the medical establishment, they wiped out everything. People knew how to heal themselves at home, right? It wasn't no, oh, I'm gonna go to the doctor, go to the hospital. No, we're gonna go pull this herb. We're gonna go talk to this herbalist, see what we need. Maybe they have what we need. We're gonna buy it from them. We're gonna fix this tincture, right? Let you take this or drink this tea. So we had natural remedies, and just that it got lost by design through the system that we're in now because they don't want you to heal yourself. They want you to go through the medical establishment. And let me tell you something else that's really crazy. There have been times where people have healed themselves of cancer. They go back to the doctor, cancer free. Doctor never questioned, what did you do? How did you do it? There's no intellectual curiosity whatsoever. They never say, hey, what did you do? Because maybe I might try this out on another patient that's having similar things. Never. Why? Because that's not making them money. You go cure yourself, how are they going to make money off of that? And I'm going to put it right there.
Absolutely. And I'm going to double down on what you just said, Portia, with Rockefeller, because what he actually did was they didn't get lost. He stole them. And what he did was he took all of their remedies and all of those natural herbs, like you said. And what he did was he bought everything up. He took all of their studying and all their research that they had of years of living on the land. And he gave that to scientists so they could remake that in the lab. They wanted to make the synthetic brand of that healing tincture. So that's what they did. They took the natural remedies and they made it synthetic. And he made it in the lab where they can mix it with chemicals and concoct. You know how they say that there's like arsenic and all this different kind of stuff in
Petroleum base.
or yeah, petroleum based. So they did that, like you said, by design on purpose. And it's really sad. It's really sad that, because although, that it's like I said, it's done toward us, but there's other people that this affects. This affects everyone here, and we're all connected. I know a lot of the stuff that we're pointing out are disparities between the races, and because those exist, they're true, and we have to point them out so we can correct them, right? But at the end of the day, we're all connected as one people. So it's really, that's what the people need to see. We're all connected as a people. They're doing this to all of us. See, we're just the Black Americans that we've it's been done to us so long that we're the only ones that speak up about it. We're the only ones that try to fight it and say something about it, because we're getting it the worst too. It seems to me like these other people don't even care about being a byproduct of that, as long as they can keep it the way it is, right? So what a lot of things that are happening now in the system is a lot of different people of races and ethnicities are waking up to that, and they're starting to see that, hey, you're not just doing that to them, you're actually doing that to all of us. And now they're starting to want to speak up and talk, and that's great. That's what we need more of that, and I'm happy for that. But again, the disparity exists because of us solely, and everything that they've done, like I said, since colonization, for this system of health, for all of the 11 areas of activity, have been done to create genocide in our community. So one thing that we can do, and it'll probably go into a solution, is, we're all numerologists, and whatever your number is connected to your health. Okay. Your number can give you some indicators about your health. So I really implore people, like, if you're going through some health things, not that we're medical doctors, but we can at least, give you a confirmation of, yeah, this has to do with your number. And it could be your birthday number, it could be your life path, any of the numbers that are your core numbers. You could have health effects from that, including your sign. So, there's something to medical astrology, there's something to medical numerology and all that kind of stuff. That's an alternative way and an alternative means to, looking into healthcare. And that doesn't mean to shun away, professional healthcare. But at the end of the day, we have to be advocates for ourselves, because if we don't advocate for ourselves, no one's going to advocate for us. And this goes back to everything that we have done as a nation in this country throughout our ethnogenesis into who we are as, foundational Black Americans to this country. Throughout that ethnogenesis, we have always historically fought for all of these things. You know what I mean? And like you were saying a little earlier, people just now starting to catch on to that. And that's okay. We've been on it because we've been experiencing it. And just because others don't experience it, they look at us and they call us victims. They call us this, they call us that. They stereotype us until they see, oh, them Black Americans ain't crazy. They are doing this shit. You know what I'm saying? So when you see that, then now you want to be like, oh, my bad. But no, the thing is, we have to advocate for ourselves. And that's something that we have always done as a community. And I also just wanted to bring up real quick how you were talking about the food desert and how important it is. Hey, the Black Panthers brought out the WIC program. They brought out the breakfast program. They're the ones who wanted to feed all the children. They brought the WIC program to life, and they brought that breakfast program. And they were about positive things, but because they were protecting the community in other ways militarily speaking, they had to get taken out, just like any other, Black faction is going to get taken out, because they can't have us rebel rousing against the system now, can they? And
Now they don't
tearing
want
up
us having
everything
our
that
own.
they built.
Yeah, they didn't want us having our own, and the Black Panthers wanted to have their own self-sustaining community,
Yeah.
the financial system, and everything, right? Their own
Yeah.
dollar and everything. And once the white folks saw that, remember, we what was our last show? The whitewashing of Black wealth, and we found out over the last 160 years that they systematically dismantled any type of Black financial structure that we could have benefited from, right?
Yeah.
It's systematically targeted. And
Systematically.
just to kind of go back to what you said about the numerology, I actually did that for a friend. She was diagnosed with cancer, and I correctly read her reading and told her what month she was actually diagnosed with that, because in that month I knew it was not a favorable month for her, and that the ailment was coming up, in that cycle that she was in, because the personal year she was in was in opposition to her birth number, right? So there is so many ways. Now, I'm not saying I predicted that the woman had cancer. No, what I'm saying is that I could tell the time that it happened right in her life. And she was like, man, how'd you know that? Because the number said that, right? And so, yes, it is a way to kind of see what energy is coming up for you. We would never tell you, give you some type of medical diagnosis or anything like that. And sometimes we can go back in hindsight to see what happened as well. So, it is very good to connect with someone who can read your energy, whether it's through the numbers, like Malinda said, and also through your horoscope. Sometimes things come up with different transits and things that may give you some opposition or bring up a time where, your energy may be weak. So definitely look into those as different modalities. But again, we're not saying that replaces any medical diagnosis. All right. So, yeah, you know what? These episodes go by so fast. It seems like this hour just flew by, and we could talk a lot more about this, y'all, because it's a long history with the medical establishment. It just ain't right in general, right? But on top of the maltreatment and the mispractices against Black people, it just makes it very hard for us to navigate such a landscape whenever we get sick. So it's always best to stay well in the beginning, right? So for me, it's all about wellness, making sure you don't get sick so you don't have to visit the hospital or the doctor. But if something were to happen, then you learn how to navigate that system. So the first solution is alternative health solutions, right? Go and seek second opinions, herbalists or what have you. Find a Black doctor that you can trust. Remember, I'm not about Black or white. I just want you to get the best treatment, right? Document your own health care, right? Write down the symptoms that you're having, what days, how you were feeling. Like take your own health into your own hands. What you ate that day, how you were feeling after you ate that. That has a lot to do with it too. Ask the right questions before you go and talk to your doctor. Have a list of questions that you want to ask them. Do your research before you go in so you know what to ask them. Get a second opinion when something feels off. Remember, oftentimes African Americans, when you go into a doctor's office, they don't validate your symptoms, right? They don't believe in what you're saying. You kind of get dismissed. So always, always, always go get a second opinion. Know your numbers and your numerology and health wise, because certain numbers have certain health ailments tied to them. So it just depends on what your number is. You may have an overworked nervous system if you're a number four, right? Because number four is always a worried. They burn out their nervous system. So, knowing your number and what kind of health ailment may come up with that. And then also taking your family name and breaking that down in numerology to see what your family health may be, right? Because this spans across not just you, but generational things. And your family may have generational health ailments that you probably weren't even aware about because of the name vibration. See, y'all, that's what I'm saying. This stuff goes real deep. It's not just about you, it's about your family as a whole and what they go through as well. So know your numbers, know your family history, and also be proactive. All right. At the end of the day, be proactive. If you're feeling some kind of way, look into it. Always go get a second opinion. If you can't go natural, great. Find a natural remedy if you can go that route. But again, we care about you, right? At the end of the day, we love y'all, and we care. And we just want to see everybody healthy and happy at the end of the day, right? And let money be a byproduct of that, but let your health come first. We're getting ready to close the show. Do either one of you guys want to say some last words?
Who going first? Me or you? Me? Okay, I got it. All right. Yep. Yes. So great show. Great conversation. Remember, this is probably one of the most important topics and important shows that we're delivering to you, because without your health, you can't enjoy or pursue your dreams, dollars, and destiny. And along with the solutions that Portia laid out, support your community farms and your farmers markets. If you're in a food desert, do your, we may not have access to food, but they're making internet accessible to everyone. So do your do your Googles, do your Facebook searches, see what's close by you in your area. If your corner stores or your grocery stores aren't accessible, see if there's farmers markets close by you. See if there's community farms close by you. Do a little research, see how you can grow some of your own things in your own backyard or even inside your own home. And along with supporting those community gardens and farms, also support your businesses, your local businesses in herbalists and health stores and things like that. You know, the solutions are out there. It might just take a little bit of work to find where those resources are. And then just also a reminder, as I said earlier in the program, to approach your health holistically and know that the mind, body, and the spirit are all connected. They are not separate. So once again, it's been a beautiful show. I'm looking forward to the next one. I'm Nick Westbrooks of Supreme Numerics, where we use the practical study and application of numerology to help you activate your personal power in abundance. And I am out. Peace.
Peace. And I want to also say for our question of the week, what will you do to advocate for your own health? So that's what we want to leave you with. We want to leave you with that. Think about some of the things, solutions, and think about what different ways are you going to start implementing to help to advocate for your own health care. And with that, that's all I have.
Yeah, and I appreciate that, Queen. And also back to the find the black doctors. I wonder why there's not enough of them that come to open up clinics or community centers in our neighborhoods, right? So that's something to think about, right? Because I
Yeah,
could
with only 5.3% of them.
I know, but why most of them don't operate in their own neighborhood,
Right.
you know what I'm saying? So maybe that's a topic for another day, but I do appreciate
Yep.
everyone joining us this week and look forward to seeing you again next week on another great action-packed episode. Thank you again. Peace and blessings. Enjoy your week. Take care.